Good afternoon. Wanted to share a brief prepared statement with you, and then I'll take questions from the media that are present. As we shared last week, on May 28th, 2020, Pitt County Health Department had to stop provision of some services due to several staff members being exposed to a healthcare provider who had tested positive for COVID-19. These members have been tested and have been quarantined at home since midday on May 28th. They are now awaiting test results and clearance to return to work. However, clinical staff who are not quarantined are continuing to provide mandated public health services. These services include pregnancy care for established patients or individuals who have tested positive for pregnancy at the Pitt County Health Department, sexually transmitted infections complaints or STD complaints, dirty puncture wounds and tetanus shots are still available. Care for dirty puncture wounds and tetanus shots are available. Care for animal bites or evaluation of animal bites and rabies vaccination is available. Suspected tuberculosis testing or treatment is available. Other communicable disease-related services remain available. Emergency contraception is available, and we continue to provide birth control method and to handle complaints in regards to birth control prescribed by Pitt County Health Department clinical staff. And those are my prepared comments for today. So obviously the right to protest as a First Amendment right is protected. We do not want to take that away from people. For people who do protest, we encourage them to maintain as much spacing as they can to try to respect that 6-foot spacing as they march or protest or stand to voice their opinion. We would encourage them to wear masks to try to help decrease the shedding of the virus or transmission of the virus in the crowd. And we would encourage them to wash or sanitize their hands frequently. I know those things can be difficult in those environments, but we would like them to try to avoid spreading the infection in the process of exercising their constitutional rights. The question briefly is, with the state reaching 30,000 cases, where are we and where in regards to where we thought we would be? How are we doing, I guess, as a community in regards to the number of cases? So let me say briefly, the modeling earlier had predicted something on the order of 750,000 cases, and that was by a couple of weeks ago. If we did nothing, employing our social distancing strategy, the stay-at-home order, the hygiene aspects of cover your cough, wash your hands, things like that, and maybe to some degree even some masking. People were voluntarily masking at the time. Even with those measures in place, we were still estimated to be on the order of something of 250,000 cases by that point in time. So from where the models had us, we're actually far behind where the models had us. And I think that's a good thing. I think less is better in this situation. Here in Pitt County, we've reached 316 cases as of this morning. We know we have over 200 of those have recovered. I haven't done the recovery count for today yet. I estimate that'll go up by at least 15 when I do the recovery count today, maybe a little bit more. We also have been following the percentage of our testing that returns positive. And we've had a change in how some of that data flows, which has resulted in us not getting all the negatives. So when you look at our raw data, we calculate out a percentage of positivity of about 10%. If we assume that we haven't received at least 100 negatives every day, which we were receiving probably in excess of 100 negatives every day from the largest tester, that would add 1,800 negatives to that count, at least 1,800 negatives to that count. So if we recalculate that as a corrected value, corrected for the missing negatives, we get to a percentage of 6.5%, which was on the curve we were following prior to that change in reporting. So the percentage of positivity for us, probably the true percentage is somewhere between 6 and 7. And again, I think that's a good place to be. The World Health Organization says we should be less than 10% in the positivity returns in order to reopen society and try to return to somewhat of a normal existence. There's some other data out there that shows that the rate of positivity is about 5% across eastern North Carolina. There's one source out there that has reported that. So I think we're in line with that in the county here, and our numbers, if we had all those negatives, might even be a hair lower.
Have anything else?
No other questions? All right, thank you for your time today, folks.
Thank you.